All right, if you're a medical trainee, you already know that getting to a diagnosis of cerebral palsy is really just the beginning. The true challenge, and honestly where you can make a profound difference, is in the long-term management. So today, let's break down a clear, practical framework you can start using in your own practice.
Okay, so first let's just quickly unpack this definition because there's a really important piece to this. The key words are non progressive impairment and expression may change. What does that mean? It means the initial injury to the brain is static, it doesn't get worse. But, and this is so important, how that injury affects the body, the muscles, and a person's function can absolutely change and evolve as they grow. Grasping that is fundamental.
And that brings us to the core question, right? You have the diagnosis. Now what? We need to shift our thinking from just identifying the condition to answering, what's the plan? How do we build an effective, structured, and compassionate framework for every single person we care for?
So here's how we're going to break it down. First, we'll cover the big picture management approach. Then, we'll zoom in on specific interventions. After that, we'll talk about managing all the associated conditions, and we'll wrap up by looking at prognosis and the future. Okay, so first things first, every single good management plan starts right here, with a comprehensive assessment and collaborative goal setting. This is our foundation. It's where we figure out our starting point and, most importantly, where we want to go, together with the family. And it really boils down to these 4 steps. 1, you have to figure out their functional status using a tool like the GMFCS, that's the Gross Motor Function Classification System. 2, you need to objectively measure their muscle tone, maybe with the modified Ashworth scale. Getting that data first is so important because then you can assemble your multidisciplinary team and finally establish goals that are truly centered on the patient. And this quote, it just nails the whole philosophy here. Our job isn't just to treat spasticity or improve a score on a test. It's about optimizing a person's function in the real world, from the time they're a child all the way through their adult life. And notice the key phrase, family-centered. They are at the heart of every decision. So how do you actually do that? Well, this is where the F-words framework comes in, and it's just brilliant. It's a simple, powerful tool that pushes us to think beyond the medical chart. It's a mental checklist. Are we addressing function? Are we including the family? Are we supporting friendships, fitness, and fun? And are we always planning for the future? It's a game changer for providing truly holistic care. All right, so we've got our assessment down. We've set our holistic goals using those F words. Now it's time to talk about interventions. We know where we are. We know where we want to go. Now, what are the tools that are actually going to get us there? I really can't say this enough. Physical and occupational therapy are not just nice-to-haves. They are the absolute cornerstones of CP management. PT and OT are fundamental for everything, from gross motor skills like walking and balance, to fine motor tasks, to all the activities of daily living that build independence.
Okay, pay attention here, because this slide is incredibly high yield for your clinical practice. It clearly lays out what the evidence supports versus what it doesn't, so you can feel confident recommending things like constraint-induced movement therapy, or CIMT, and goal-directed functional training. But just as important, you need to know what's not recommended, so you can help guide families away from therapies that lack strong evidence, like NDT. And then, of course, you have your orthotics and assistive devices. It's so critical to reframe these in your mind. They aren't just passive supports. They are active tools that enable function. A brace can prevent a contracture down the line. A stander is vital for bone health. And a well-fitted wheelchair, that's not just about getting from point A to point B, it's about autonomy, participation, and independence.
Okay, so we've talked motor, but now we gotta zoom out. To manage CP well, you have to look beyond the motor symptoms. You have to be proactively looking for and managing all the common associated conditions because they have a massive impact on quality of life.
And this number, wow, it just stops you in your tracks, right? Almost half of all kids with CP also have an intellectual disability. This is exactly why early and regular developmental screening isn't optional. It's absolutely essential. And it's not just about intellectual disability either. Look at these numbers. Epilepsy, vision problems, they're just as common. And psychiatric disorders are significantly more prevalent too. The big picture here, CP is a multi-system condition. You have to be a detective and look everywhere. Okay, let's take one of these issues, siluria or drooling, and use it as a perfect example of how to think through a problem.
It's super common, and it perfectly illustrates this tiered, start simple, and escalate approach that you can apply to so many other issues.
And here's that model. It's a classic step-up approach. You always start with the least invasive thing, right? So behavior therapy. If that doesn't cut it, you can move up to medications like glycopyrrolate. If that's still not enough, botulinum toxin injections are an option. And surgery? That's reserved for the most refractory cases. See the logic? Least to most invasive.
And listen, don't sleep on these other areas either. Things like chronic pain, GI issues like reflux and constipation, sleep disorders, and bone health are all incredibly common and can be huge sources of distress. Just asking a simple question at every visit, how's your sleep? Are you having any pain? Can be a total game changer.
All right, let's shift gears to our final topic, prognosis. And let's be honest, these can be some of the hardest conversations to have with families. But providing clear, data-driven, and hopeful guidance is one of the most important things we do.
So this table gives us some good predictors to work with. For instance, we know that if a child can sit independently by age 2, that is a very strong predictor of them eventually walking. But, and you have to say this every single time, these are patterns and probabilities, not prophecies. Every child writes their own story. You see a similar pattern when you look at long-term survival, which is closely tied to motor severity, as measured by the GMFCS. For kids at levels 1 and 2, survival is excellent. But for those at level 5 with the most severe impairments, it is significantly reduced. This is tough information, but it's so critical for having honest conversations about long-term care planning.
So when you put it all together, what's the bottom line? 2 things. First, the very good news. The vast majority of kids with CP live well into adulthood. Second, our clinical call to action. Respiratory disease is the #1 threat. That means proactive respiratory care, managing secretions, preventing aspiration, treating infections aggressively. That's where we can make a massive impact on longevity. And that really brings us right back to where we started, to that final F word, future. Our job doesn't end with the diagnosis or therapy referral. It's about being a partner for the long haul. It's about working with people and their families to build a life that's as functional, as joyful, and as full of possibility as it can be for their entire future.